Hi, I'm Beatrix, and we are the Sensible Company. We're building an IoT-based inventory management system to automate logistics processes for medical consumables in hospitals. Why? Okay, well, imagine that you're in the hospital. You've been tested positive for COVID-19, and you've been coughing your lungs out for the past 10 minutes. The nurse finally comes with a respirator valve. Sorry, we ran out. I had to go to another ward to find one. And 45 minutes later, another nurse runs back with a fresh box. Isn't this horrible? Patient care quality decreases when patients don't receive the items they need in time, and when their nurses are spending, on average, 22% of their time on inventory management instead. As patient care quality is hospitals' #1 priority, they have a clear motivation to solve this problem. This is how key stakeholders in 90% of Singapore's public hospitals have described their needs and wants. Basically, they need to know how many consumables are in each ward, and they want to use this information to forecast consumption and optimize their inventory metrics. However, they are currently using inefficient manual counting methods like pen and paper and barcode scanning. Because of this, inventory visibility is low. Logistics managers can't make good forecasts and tend to waste by overstocking rather than sacrifice patient care quality. But overstocking isn't feasible, not when hospitals can stand to reduce their supply expenses by 17.7% per year. Based on SingHealth's annual report, this would translate to a whopping $398 million in annual savings for Singapore's public hospitals. We think that the solution is to use IoT-enabled weight sensors to automatically measure and record stock data in real time. Then we can use the data to automate forecasting, optimization, and other logistics processes. So it works like this. Our sensors count the consumables in their bins. We email a refilling list to staff, log data, and update the dashboard. Logistics managers always know the stock levels in each ward and can get good data to make good forecasts. Our end goal will be to automate the entire internal supply chain process like this. So we're finishing up our automated stock taking solution now, and we plan to develop proof of concept forecasting and optimization tools by 2021. With this holistic solution, we can scale up to meet the coming needs of the healthcare system on a national level and go beyond the level of individual hospitals. This is something our competitors cannot accomplish because they are not affordable or effective. So let's take a look at our closest competitors, SIS and StockView. While SIS analytic tools are impressive, it requires hospitals to collect data through barcode scanning each item, which we've already learned is not effective. As for StockView, it offers IoT-enabled weight sensors as well, but then they come with a hefty price tag of $600 per bin. This makes StockView unattractive because based on feedback that we got from hospitals, the cost of tracking a consumable should not be greater than the cost of the consumable itself. So instead of charging $600 per bin, hospitals will rent our sensors at $24 per bin per year with a minimum order of 500 bins. As for software, we're pricing it starting from $200,000 a year. I'm sure hospitals will find our solution value for money, given how we save them $470,000 a year in manpower alone and shorten the restocking cycle by 43%. We're offering a valuable solution that hospitals will buy, and our market research findings agree with that. In fact, we expect demand to grow, especially considering how COVID-19 showed the world the importance of a resilient and future-ready supply chain. And in fact, we've already validated our product with a pilot customer. KK Women's and Children's Hospital has signed a research collaboration agreement with us, funding us $3,000 to trial our automatic stock-taking prototype. Our second trial is underway, and they've invited us to publish the results of our trial at regional and local conferences and competitions, and endorses the ALPS, the company set up by the 3 healthcare clusters to meet the supply chain needs of Singapore's hospitals. From user studies with nurses and logistics assistants, we have testimonials that our solution effectively ensures nurses never run out of medical consumables. So after we finish this trial and develop our forecasting and optimization tools, we will use the exposure from conferences and competitions to get our first customers in the Asia-Pacific region, which will help us become self-sufficient, further refine our technology, grow bigger, and win the government tender in Singapore in 2024, thereby obtaining 100% of our serviceable obtainable market. However, we'll need your help getting there. We estimate that we need $100,000 over 15 months for manpower, R&D, sales, and miscellaneous expenses. And to end off, here's the team who's going to multiply your money. We have over 9 years of combined experience in working for healthcare and supply chain related products. And what our degrees won't tell you about us is that we're also bringing competencies in IoT, deep learning, supply chain management, and business development to the table. So choose a sensible company. Let's create the future of healthcare together. Thank you.